You're welcome to our today's class. Today we'll take a look at pathophysiology, pathophysiology of the cardiovascular system. Pathophysiology of the cardiovascular system as a way of introduction. So I want us to have an overview of what the cardiovascular system is. Just a short overview, then we'll take it off from there. In this topic, we are going to learn the relationship between oxygen supply and oxygen demand. We're also going to learn the risk factors for cardiovascular disease and at the same time the causes, pathophysiology of the cardiovascular diseases. Okay, so let's look at the cardiovascular system. The cardiovascular system actually starts its activity when the fetus is around 1 month old, and this is the last system that ceases activity at the end of life. That is the last system that stops working at the end of life. Other system dies before, gives up before cardiovascular system. Okay, so cardiovascular system is made up of the heart, the arteries, the veins, and the lymphatics. And all the structures I mentioned, transport oxygen and nutrients to all cells. So they transport life-supporting oxygen and nutrients to cells. They also remove metabolic waste products, and they also carry hormones from one part of the body to another. Now, during normal heart function, circulation occurs due to the continuous rhythmic contraction of heart muscles, and this propels blood through the system. So the heart keep contracting rhythmically, and it's continuous. So this continuous contraction lead to what? The flow of blood through the system, from the heart through the vessels to the entire system, body system, to the various cells where they are needed, and tissues where they are needed. So actually, cardiovascular diseases are the leading cause of death, especially in the United States of America. And these diseases are heart attack, myocardial infarction. In fact, heart attack or myocardial infarction is the primary cause of cardiovascular related deaths, and it can occur without warning. Now, how does cardiovascular system help to balance the oxygen? How does it strike a balance between the oxygen demand and oxygen supply? So under normal circumstances, there is a critical balance between oxygen supply and oxygen demands. So for whatsoever reason, whenever there is a decrease in oxygen supply, or an increase in the heart muscles oxygen demand, there is an issue with this balance, and this issue with the balance affect the myocardial functions. So there are four determinants of myocardial oxygen demands. There are four things that determines the amount of oxygen demand. Oxygen demanded by the system. By the heart, sorry. Those factors are as follows: heart rate, the contractile force of the myocardium, the muscle mass, and the ventricular wall tension. These are four determinants of myocardial oxygen demand. So, when there is cardiac workload, when the cardiac workload and oxygen demand increases, is a sign that the heart rate also is on the high side. So in another way around, if the heart rate increases, or if the force of contraction becomes stronger, then the cardiac workload and oxygen demand will do what? Increase. At the same time, this can also occur in hypertension when the blood pressure is high, even during ventricular dilation and the heart muscle hypertrophy. Some medication can also cause this. So what am I saying? That increase in heart rate, or force of attraction, or strong force of attraction, can increase what? Cardiac workload and oxygen demand. I've mentioned other things that can increase cardiac workload, things like hypertension, ventricular dilation, heart muscle hypertrophy. Now, if the myocardial oxygen demand increases, that means oxygen must be supplied for the balance to be what? Maintained. So, in order to effectively increase the oxygen supply, you start seeing that the coronary artery, the perfusion of the coronary artery must also do what? Increase. Now, there's a very important stimulus that causes coronary arteries to dilate and increase, and subsequently leading to increased coronary blood flow. That is hypoxia. Hypoxia, that is lack of oxygen in the tissue, decrease in tissue oxygen level. So when there's decrease in tissue oxygen level, when there's tissue hypoxia, is a very important stimulus that can lead to coronary artery dilation and even increase coronary blood flow. Under normal circumstances, coronary blood vessels can dilate on their own and even increase blood flow up to 5 to 6 times above the resting level. But once stenosis sets in, there will be decreased vessels. These vessels will not be able to dilate again. And because they're not able to dilate again, oxygen deficit may result. So it's very important to guard against stenosis. Now, since the heart must contract continuously, rhythmically, in rhythm, Then to be told that blood flow is also continuous. Blood flows unimpeded. Blood flows unimpeded. And one thing, if you in physiology, anatomy and physiology, you must have studied about the structure of the heart and the heart vessels, what the heart vessels do. Of course, we have the chambers of the heart, the four chambers, and each of them has its own vessel, up to two of them. The vessel guard, the blood that enters the particular chamber. So the normal flow of blood in the heart, one is that the flow is unimpeded. Second is that the heart valves makes it to flow in one direction. Under normal circumstances, they are nothing like backflow. Yeah, there is nothing like backflow of blood under normal circumstances. It's only one direction. Now, how does the valves help to maintain this one directional flow? Now, the opening and closing of the heart valve is dependent on the pressure gradient across the chambers. Now, if the pressure in a particular chamber is 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 higher than the pressure in a chamber that is closer to or below it or before it, in that direction, if the pressure in a particular chamber is okay, let me put it this way. To maintain this unidirectional, one directional flow, the valve opens and closes in this manner depending on the pressure gradient. We have four valves, four chambers. Now, if the blood enters chamber A before entering chamber B, then before entering chamber C. Now, if the pressure, if the pressure, if the blood pressure in chamber A is higher than the blood pressure in chamber B, what happens is that the valve will open. This opening of the valve will allow the blood to now move towards pressure B, to chamber B. Now, when the blood moves to chamber B, there will be pressure built up in chamber B. Now, when this happens, of course, when it enters, the pressure in chamber B will become higher than the pressure in chamber A. And when it happens, the valve that links pressure chamber A and chamber B will close. Now, as the pressure is built up in chamber B, you see now the pressure in chamber B is now more than the pressure in chamber C, which is the next chamber it will go to, because it has been built up. The pressure is built up and higher than that in chamber C. The valve that links chamber B and chamber C will open, and blood flows into chamber C. And once blood flows into chamber C and go to the extent that the blood pressure in chamber C is higher than the blood pressure in chamber B, the valve will do what? Close. So that is how it works. That is how it works. Now, this valve, this the valve cusps or the leaflet of the valve are very, very responsive to even slightest, even less than 1 millimeter mercury pressure difference. It will close and open or open. It will close because it's highly what? Sensitive, responsive. Now, the issue now comes when this valve has have issue. This valve that guards the heart chamber, when they have issues, that's when the problem occurs. Now, when the valve is diseased, it causes a major issue in blood flow. In fact, there will be low blood flow because once a valve is diseased, blood, it cannot control how blood, that unidirectional flow of blood again. You see blood flowing backward. You see blood flowing backward because those valves will not be closed well because they are diseased. So this process of phenomenon whereby of backward flow of blood is called what? Regurgitation. So this backward flow of blood through the valves will now force the heart to pump more blood, because as the blood is flowing, that means they're going back to the heart. It's causing the heart to do more work by what? Forcing it to do what? Pump more blood. And because of this increased pumping of more blood, it will lead to what? It will lead to what? Increased cardiac workload. Remember I mentioned cardiac workload before. Now look at it. Because the heart muscles, they are what? Overloaded. They keep pumping because more blood are coming back, and as they are coming back, they keep pumping. So this increases what? Cardiac workload. Now sometimes due to calcium buildup, even the opening of the valve will become an issue, will become restricted, and this will impede forward flow of blood. So this is this situation of whereby the valve ceases to open is refers to as what? Stenosis. Stenosis. Of course, when the heart fails to pump enough blood that will help the other part of the body, that means the heart has failed. That means the heart has failed because its primary role is to help to pump blood, because blood is loaded with nutrients and other things. So that means the heart has failed. So the heart may fail to meet what? The tissue metabolic requirements for blood. It may also fail to function as a pump because of this. So basically, once the heart fails, the entire circulatory system will do what? Fail. Because the body tissues will not be perfused normally. And the blood volume and vascular tone may also be what? Altered. Can you hear me? Hello, can you hear me? Please unmute your mic and answer. Can you hear me? Hello? Okay. Let's continue. So the body actually monitors closely both the blood volume and what? The vascular tone. both the blood volume and what? The vascular tone. Now, blood flow to each of the tissues is monitored by microvessels, and these microvessels measures how much blood that each tissue needs.
Hello?
Okay, you can hear me, right?
Can you hear me?
Yes, I can hear you. Hope you can hear me.
Yes, yes, sir, I can hear you clearly.
And please, if you have any question, please feel free to ask. Okay.
Yes,
All right, let's continue. So
yes.
I said that the body closely monitors the blood volume as well as the what, the tone, the vascular tone. So actually, what happens is that the blood flow to each of the tissues is monitored by microvessels in each of these tissues. Microvessels, see them, microvessels. They are being monitored by and how how is it done? These microvessels found in each of the tissue, they they measure how much blood each of the tissue needs, and also control how the local blood flows locally in each of the what tissues. And the blood vessel, all these blood vessels like arteries and veins are like highway. They are like high tension. They are like highway, the main major way through which blood flows. When blood now enters the each of the tissues, you start seeing the tissue capillaries and all capillary bed and all these microvessels. All those ones, arterioles and the capillaries, all those ones are the one that is local in that tissue. That one that will now that one that actually point out the actual measure and also point out the actual blood need, tissue needs, ranging from the nutrient and other things. And they are also the one that collects waste products from the cells and tissues and send them back to the what? The main veins that will now take it back to what? To the heart, to the where they are needed. If it is one that will need to be to
I came to hello, sir.
you know
Hello, yes. Sorry, I came to class. So, what are we talking about?
let's come on. We are talking about we are treating the course is from to clinical pharmacy, right?
Yes,
Now,
sir.
specifically, we are at this level, this aspect of clinical pharmacy, we are talking about pathophysiology of different systems.
Okay, sir. Part of physiology of different systems.
So today we are talking about the pathophysiology of the cardiovascular system.
Of the what?
Cardiovascular system, CVS.
Okay, yes, sir.
So, and the pathophysiology of cardiovascular system, we started, as I started from the overview and of how the heart works, how the cardiovascular system works, the component of cardiovascular system, and oxygen demand
Okay.
and oxygen supply, and that's where we are now.
Okay, we're in oxygen demand and supply, yeah?
Yes, 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 and how the heart and the cardiovascular system in general, work. Even the valve,
Okay,
what
sir.
they do, and what happens when the valves are not okay.
Okay, sir.
I,
So, sir,
yes,
sir,
I'm
so
with you.
you we sir, I did not hear what you said.
I'm with you.
Okay, okay, okay. So, sir, we're now discussing oxygen supply and demand based on the microvessels that are found on the tissue, which can also be used to measure blood and how it flows. Yeah.
Yes.
Okay, sir. We can continue.
If you come late next time, I will not talk to you.
Ah, sir, sorry, sir. I thought it was like maybe during the daytime. I didn't that the thing is actually 3 a.m. through. Sir, what happened? Yeah, with 3 a.m.
All right. So, So let's continue. So I was trying to point out the work of these micro vessels in the tissues. Is that clear?
Yes.
Yes.
Yes,
So
sir.
all right. So
The works of the microvessels.
yes. What they do, and of course they are the one to say, okay, this is actually what the tissue needs. Is that clear? And this
Okay,
is
sir.
what should leave the tissue and how it should leave the tissue. They are the local champion, like gather, send the blood, the blood that flows into the tissue to the different part of the tissues. Yes. So the of course, now we cannot talk of this circulation without talking about the nerves. There are nerves that control circulations, and these nerves also help to direct blood flow to tissues. These are things you discuss in your anatomy and physiology. Is that clear? So let's not dwell.
Okay, sir.
Let's not. Hope your anatomy and physiology your physiology lecture is on and your anatomy and also an anatomy lecture. Have you
Eh,
done
Sir,
any anatomy lecture?
eh, sir, anatomy.
Mm.
I feel like because we have done physiology, but I don't know for anatomy. But I know the yes physiology because the in our course outline they put general physiology too. So I don't know whether it's the anatomy and the physiology done together.
Okay, let's keep going. Our focus here is in pathophysiology, but you know why I keep mentioning physiology and anatomy in small in peripherally is because you cannot be talking about pathophysiology without mentioning them. Yeah.
Okay, sir. You say we are discussing clinical pharmacology, yeah, on based on physiology of cardiovascular, yeah.
Wait, so which course did you come from? Which course? You don't even know the course, the course I'm taking you on. I don't understand.
I know the course you're taking us on. I just want to be sure on the course that I'm doing.
You want to be sure of the course you are doing. You're funny. You're very funny. Please, let's continue, please.
Yes. Okay. No, sir, the reason why I'm asking is because
Yeah,
you were
yeah.
explaining how it works and everything. So I want to know like what makes this part of physiology of the cardiovascular system. How is it like important? How is it linking to this clinical pharmacy? That's why I'm asking.
See what you do for me, eh?
Yes.
See what you do for me.
Ashwat?
Can you hear me?
Yes, I can hear you.
Yes, now, if you're asking me how pathophysiology is linked to clinical pharmacy, it's a good question anyway. It's a good question.
Yes.
I like that question. It's a good question. Maybe you ask because you want to appreciate what you're doing. You can,
Yes.
as a clinical pharmacist working in pharmacy or hospital, wherever you are working, you have patients. You want to take care of the what is it called, the
If-
the 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 the, the drug related issue, pharmaco,
Yes.
pharmaceutical care. How
Yes.
can you talk about drug issues when you don't even know what you are treating,
Hmm. Interesting.
and what you are treating, how it came about, what leads to it? Do you not
Okay,
understand?
sir.
Do you not understand why it
Yes.
is very important?
Yes.
That's why you first do your physiology, do your anatomy. Those ones are normal, normal body function and body structure. That one is normal. We come off to pathophysiology, pathology now. You also study it, those part of those anatomy and physiology in diseased, those part of the body in diseased states. and what can lead to them being in diseased state.
Okay, sir.
When you know about pathophysiology, that's when you now come up and you now know of pharmacotherapy. How do you now combine pharmacology in the therapy of those disease states? Pharmacotherapy is also another part of clinical pharmacy. But for second year now, our focus here now is not pharmacotherapy. Our focus here now is you are still in second year. By the time you come up to third year, you start. If you understand what you are doing now, if you understand your anatomy and your physiology and understand your pathophysiology, your anatomy and your physiology they are basic medical sciences you are doing as separate courses in pharmacy. Now,
Yeah.
pathophysiology is in clinical pharmacy now because pathophysiology now is built upon your knowledge on anatomy and physiology. But in disease state, when you are done with it now, maybe if you come up to third, fourth year, you start doing your pharmacotherapy. How you can now apply your knowledge of pharmacology, knowledge of anatomy, knowledge of physiology, knowledge of pathophysiology in treatment. Does it make sense to you
Yes,
now?
sir.
Hmm?
Yes, sir. Yes, sir.
Please, let's continue. So we don't wait. Your exam is next month. So we don't wait. Anyway, it's good I explain. So you understand and also take seriously what you are doing. Maybe that will make you to be not to be coming late to class.
Okay, sir.
Now let's continue. So
Yes.
now I said that micro vessels in this tissue that want to measure that measure blood flow there and also know exactly what the tissue needs. And
Yes.
the heart pays attention to the needs, tissue demands, the demands of all those tissues. The heart pays close attention and it responds. So when there is signal, of course the nerves are also there to send what signals. Am I communicating? The nerves are
Yes.
also there to send signals to the brain to the heart, where the attention of the heart is needed, and they have pump blood there, pump blood, nutrients. Have you noticed that? Let me ask a question. Have you noticed that
Yes, sir.
when you eat food after eating, let's say
Yes.
a few minutes after eating, you feel
Yes.
you feel a bit look as if you feel a bit sleepy.
Yeah.
Do you know what causes it?
I feel like it's when the food undergoes the metabolism process.
And it's not just at that level. Yes, I agree, but you see, immediately food enters their system. Immediately,
Yes.
after doing in fact doing digestion self shortly before assimilation, absorption, the heart, the signal will come from the GIT to your brain. From there it will interpret it and go to your heart to send a message that enough is needed in the GIT for absorption. Is that clear? To take
Yeah.
nutrients. Now, when that happens, most of the blood will be channeled to that GIT. There will be a kind of
Yes.
reduction on the blood flow, even to other parts of the body, even the brain. You start feeling as if you want to feel sleepy, but after some time, it will clear.
Yes. Yes. So
So,
what is GIT?
GIT is gastrointestinal tract.
Okay.
So I just use this to explain to you that the heart actually pays and knows what happened
Does
and where to direct more blood
the
at a particular point in what time.
time.
Exactly.
Okay.
So
Yes, sir.
the heart pays attention to tissue demand. It also responds to return of blood through the veins. Of course, now blood also return. Of course, the blood that returns from the tissues, you know what it contains now: oxygen. Sorry, carbon
Yeah.
carbon dioxide, waste products of metabolism, and all those things. Is that clear? Now,
Yeah.
so that's how the heart responds to tissue demands and the demands and this tissue oxygen demands and supply. Now, of course, the another thing that you need to understand about how the heart works is that the pressure in the artery is regulated by the body. This is where the issue comes now. The pressure is regulated by the body. Once this pressure is not well regulated, issue will come in. What do you think? Do you think will happen when the blood pressure is not well regulated? What will happen?
Cardiac arrest.
No, the first thing that happen is high blood pressure. True of us.
True.
Now let's continue. So now, if the blood pressure falls below or rises above a normal range, there will be changes. There will be a lot of changes in the circulatory what system. There will be a lot of changes in the circulatory system. So let's start from when the blood pressure is low, below the normal. So when the arterial blood pressure is below the normal, see what will happen. The heart rate will increase. When the arterial blood pressure falls below normal, the heart rate will do what? Increase. Heart rate will increase. The heart will try to pump more blood. Is that clear? The heart rate
Yeah.
increases, and the force of contraction of the heart will also do what? Increase.
Good.
Force of attraction of the heart will do what? Increase.
Include.
Yes. At the same time, arterioles, the constriction, there will be constriction of the arterioles, not arteries, arterioles. There will be constriction of the what? Arterioles.
Arterial.
Are we together? So these things
Yeah.
happen when the blood pressure falls below normal. But when the arterial blood pressure rises above the normal, look at the changes that will happen. There will be a series of reflex action that will lead to slowing of the what? Heart rate. The heart rate will do what? Slow. Then there will be what? Decrease in force of what? Attraction, force of contraction. Force of contraction will do what? Decrease.
Decrease.
This whole thing is targeted to reducing the what? The arterial what? Blood pressure. Is that clear? Now,
Yes, sir.
there will also be what? Vasodilation. There will also be what? Vasodilation. The blood vessels will do what? We expand so as to reduce the what? The blood what? Pressure. Now, you've done homeostasis in physiology, right?
Mm,
Have you done homeostasis?
no.
You've not
So you said the direction expand so as to reduce what?
the the blood pressure.
Okay.
All these things that I just talked about now, we call them negative feedback mechanism in homeostasis. Negative feedback.
Because
We call them negative feedback mechanism in homeostasis. That is physiology.
okay.
Now, so what are the factors? What are the risk factors? We are now gradually entering cardiovascular what? Diseases. Okay.
Okay.
So what are the risk factors? What are the risk factors for cardiovascular diseases? What are the risk factors? So we look at the risk factors in two categories. We look at the risk factors for cardiovascular diseases. We look at them, they fall into two categories. We have the We have the modifiable risk factors and the non-modifiable risk factors. We have the modifiable risk factors and the non-modifiable risk factor. So let's start with the modifiable risk factors. So what are the modifiable risk factors? So this one are those factors that can be avoided or altered. They are the factors that can be avoided or altered. So if you modify them or alter them, you can actually, you know,
Avoid.
you can actually, by modify or alter them, you can actually slow down the disease process, or you can even reverse the disease process. Are we together?
Yeah.
So that means you can do something about them. That's what it means. So those factors are as follows. They are as follows.
Mm.
Elevated serum lipid levels.
Sir?
Am I blowing grammar?
I never hear you say
Okay, I said elevated serum lipid levels.
elevated serum
Lipid level. The one you call
lipid.
the one you call hyperlipidemia.
Okay.
You can just say hyperlipidemia when there is, high level of what? High level of what? Lipid in the what? Serum. Is that clear? In the blood. Is that clear?
Yes.
Hyperlipidemia. The one people call hypercholesterolemia, whatever they call it. So when there is high lipid in the blood, so it can actually is a risk factor for cardiovascular diseases.
Mm.
And it's modifiable because you can actually modify your what? Lifestyle. True of us.
True.
Yes. The next one is hypertension. Hypertension is another risk factor. The next one is cigarette smoking. Cigarette smoking is a risk factor. Next one is diabetes mellitus. Diabetes is a risk factor. Hope you know what to mean by risk factor.
No, you did not say it though.
Those ones are factors that can predispose one to developing cardiovascular diseases.
Can expose one to develop vascular diseases.
That can predispose
Predispose.
one to, developing cardiovascular diseases.
Okay.
That is what it means is that if you are living this type of lifestyle, or if that thing is in your system, there is high tendency that you develop cardiovascular system over time, cardiovascular disease over time.
Mm.
Is that clear?
Yes, sir.
So that the factor that predisposes somebody to what? To developing
Vascular disease.
cardiovascular diseases. Now the next one is sedentary lifestyle.
Sir? Of what?
Another modifiable factor is sedentary lifestyle.
Sedentary lifestyle.
The person, somebody you just there. You are not exercising. You no exercise. You are maybe you may to even crown it. You may be to even make it worse. You may be somebody that is doing office work from morning till night. You are in the office. You are sitting down one place. You don't even go for to gym. You don't even exercise. Nothing. No exercise. Nothing. That's what we call what sedentary lifestyle. It can predispose one to what developing cardiovascular what.
Diseases.
Another one is stress.
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 Stress. Stress now. It's
Stress now, S-T-R-E-S, stress.
stress. We are saying the same thing.
Huh?
We are saying the same thing, sir.
Okay, okay, okay. I thought you didn't hear what I said.
No, I heard you.
Stress can stress is also a risk factor. Obesity, obesity,
Obesity.
obesity is a
So
risk.
you can control this one too.
Huh?
You can control this one too.
Of course. And
Okay.
especially abdominal one, abdominal obesity, especially abdominal one. You see those people that have abdominal, that's why you see some of them, they want to go and do surgery to tuck in their, have you heard of that before?
No,
Yeah?
no, sir.
They will go and suck fat around the abdomen. They go and do
Yeah.
some. Abdominal obesity can cause, is a, especially abdominal obesity. In fact, for men, for men that have waist measurements, waist measurements,
Mm.
the measurement of their waist is greater than 40 inches. That is 101.6 centimeter. Is a risk factor for men. Men with their waist measurement greater than 40
Yeah.
inches, 40 inches, or
Yeah.
101.6 centimeter.
It's a risk factor.
Then for women, their waist measurement is greater than 35 inches. That is 88.9 cm. Is also an issue. So if your waist measurement is is on the increase, you may be you may be at risk, increased risk of developing heart disease. So
Hmm.
hope your own waist is not big, is not too much.
It's just them.
All right, so now let's look at
Okay.
non-modifiable risk factors. Non-modifiable risk factors. So there are four of them I want us to list. There are four non-modifiable risk factors that can increase persons someone's risk of developing cardiovascular disease. Number one is age. Number one,
Age.
age,
Okay, sir.
age. Number two is male gender,
Male gender.
male gender.
Uh-uh. Sir, I don't understand.
Male gender. Males are more prone.
Eh.
Not that female don't develop, oh, but male are more. The risk
Wow.
the risk is more in male than female.
Yeah.
Is that clear?
Yes, sir.
Then family history.
Family history.
Then at the same then race.
Yes. So
Race.
how does family history affect generations of stuff?
And now some it has genetic undertone now.
Okay. Every this we have been.
Yes, now if you are family, if your parents, if any of your parents had cardiovascular diseases, maybe trace and maybe their great grandfather had it or whatever, please, there's high tendency. Such person should watch his or her lifestyle because
Okay.
the tendency is there. But the person can still live his life without developing them, but depending on the lifestyle of the person.
Okay.
Okay.
Eh.
So most with these things I've listed now, it's clear that most of the risk factors, most of the risk factors of cardiovascular diseases are modifiable.
Yes.
So that means
Can.
greater percentage of cardiovascular disease the cardiovascular disease will develop. I would say some of them, most of them occur as a result of carelessness that may stem out of ignorance anyway. Hope you know.
Carelessness.
I say most of them, greater percentage occur because of carelessness
Mm.
that may come as a result of ignorance because some may not
Yeah.
know and they just be eating, not doing
Eating.
exercise, smoking, doing all those things without even knowing what they're doing to themselves. You understand what I'm saying?
Yes.
Now, so so for one to, with age,
Sour pepper soup.
can you hear me?
It says soup. I guess soup.
Okay, okay, don't worry. I said, as someone grows old,
Okay.
as someone grows old,
Yes.
the person becomes more susceptible to cardiovascular diseases.
Okay.
Yes. So with age, grow old, the more you become susceptible to what? Cardiovascular
Well,
diseases. So it is not a normal, even though yes, some people develop it before 40 years, but it's not something that is usual. It's not, anyway, it's not something that is usual. Am I concluding?
yeah.
There may be other underlying factors. In fact, time, most time people develop it at at before 40 years. Then,
Okay.
uh, there's always an exception in general rule. Is that clear? And there's always
Yeah.
an exception. So these ones are just few cases, but most of the time, those things are developed beyond 40 years. Most of the time, beyond what? 40 years,
What?
40 and above. That's why they'll tell you there's one drug in the market, one drug they say low dose aspirin. Have you heard of low dose aspirin?
No, sir.
And they used to, it has a vasoprotective activity. It used to ensure that everything that the walls of the heart, of the vessels, small vessels in the heart are free, nothing is blocking it, and the blood flows in the coronary artery well without issues. Now, they always say once from 40 years, it's recommended that from 40 years that you should be taking the vasoprene at least once a day for 40 years and above. Do you know why they say that? Because 40, you believe that most of these things develop beyond what? 40 years. So that's why I say that those that develop these cardiovascular diseases below 40 years is what? Unusual. Is what? Unusual. Are we together?
Yeah.
Now, now, of course, as I said before, now, if you expose yourself other risk factors, may not be the tendency to develop this in earlier is also there too.
Yes.
Yes. if you have a long duration of exposure to these other risk factors, the tendency to develop this is more what? More the tendency to develop it will be more earlier self.
Yes.
Now, remember what I said before now that men, it's not that women don't develop heart disease, but women are less susceptible than men.
Yeah. Okay.
Listen carefully. Listen carefully. Before menopause, before menopause,
Yeah.
before menopause, women are less susceptible to heart disease than what? Men. But after menopause, women become as susceptible as what? Men. Is that clear?
Yes, sir.
Before menopause, women are less susceptible. But after menopause, they become as susceptible as what? Men.
When?
Yeah. So there is a theory that proposes, or there's theory that proposes this, and that theory said that is because of estrogen. That estrogen has a protective effect. Is that clear?
Yeah.
Because of the estrogen before menopause, of course, you know that before menopause, the estrogen level in female is high. Hope you know.
Yes, sir.
Yes. So because of the role they play in menstrual flow and reproduction, is that clear?
Yeah.
So this estrogen has protective effect. That's why before menopause, women are less what? Less what?
So,
Susceptible. It's 5 o'clock. It's 4 o'clock. Please, I think we'll stop here because I have another class by 4, and they
yeah,
are
yeah, free, sir.
waiting for me now.
Thanks,
Thanks,
sir.
sir. We'll stop here. Do you have any question?
No,
No,
if
if
I
I
have,
have,
I'll.
Okay. Your class have refused to pay for your materials. Even you, Chiamaka. What's your problem? Your class.
Sir,
Sir,
I,
I
I don't
don't
know.
know. You say what?
Sir,
So, and that's what you plan me saying. You pay. So what are you going to pay?
I don't know.
You don't know when you will pay.
But
But
by
I
the grace,
request, huh?
I
I
feel
feel
I
I
will
will
pay.
pay. Okay. All right. Take care.